We offer a 99% cure rate for first-time skin cancer treatments for this, so it's the highest that we have to offer. It's the gold standard of treatment. The process was originally invented by Dr. Frederick Mohs, is his last name, M-O-H-S, and it was done in the 1930s is when he first started the procedure, and then it's evolved and changed in the 1950s to what it is today. It's a wonderful process that we can offer for our patients here. So the process starts off with the biopsy, and then that biopsy shows a skin cancer. Depending on the site, determines whether it's appropriate for Mohs. So certain locations on the body are appropriate: head and neck, hands, shins, feet, groin. Areas where we don't have a lot of skin to spare, we want to keep the area as small as possible, so that way the scar is small as possible. Those are indications. So if a patient is deemed appropriate for Mohs surgery, then they come to see me. And that process is basically, we go around the same site that was biopsied with a 2mm margin, and I cut it out, and then I take it to my lab, and my histotech is able to cut the tissue, process it, and stain it. And the whole goal of Mohs surgery is we're looking at 100% of the margin. So the way that the tissue is cut and processed allows us to look at all of the tissue layers in one margin plane. And it's stained, and then I look at it underneath the microscope, and I can see the tumor cells, and I treat it like a clock. So if I see any tumor cells between 12 and 3 o'clock, then I go back to the patient. They're waiting out in the waiting room during this time. We take more tissue just between 12 and 3 o'clock, so we can keep it very small and very precise. And that process repeats until we get it clear. And then at the end, we have a circle where we've taken out the skin cancer, and then it's stitched up that same day.